Did you know that up to 70% of autistic children have significant gut problems? And these gut issues can directly affect their behavior, sleep, attention, and even speech development. In this video, I'll explain 5 common gut problems in autistic children and simple strategies that can help improve their gut health. I'm Dr. Chisom Pascaline, a medical doctor and a certified autism specialist, and I help parents understand the biomedical factors that influence autism, especially nutrition and gut health. So let's start. 1. Constipation in autism. Constipation is extremely common in autistic children. Some children may pass stool only once every several days, like 4 days, 5 days, or thereabout. The stool may be hard, painful, or even very large. So this happens for several reasons. Maybe a low fiber intake, or there is an imbalance in the gut microbiome, or due to food sensitivities or poor hydration, like if the child is not taking enough fluids. Constipation can actually lead to irritability. The child becomes very irritable, abdominal pains or discomfort, sleep problems, and behavioral outbursts. Simple support strategies is to increase fiber-rich foods such as vegetables, beans, sweet potatoes. Now, we know that most of these children have some sensory intolerances, or some of them have some sensitivities. They can actually reject food based on sight or texture. So there are several good ways, easy ways to hide foods successfully that can actually help them. You can get that in the link below. So ensure adequate hydration and include gut-friendly foods that support digestion. 2 is diarrhea. So some autistic children experience the opposite problem. So here they have frequent loose stools or chronic diarrhea. This may be linked to food intolerances, gut inflammation, microbial imbalance in the intestines. So diarrhea can affect nutrient absorption, which means that the child may not get enough vitamins and minerals needed for brain development. So what can you do to help? So you have to identify and reduce the trigger foods. You should actually keep a journal to be able to identify the food that if your child takes, they have diarrhea or these issues. And this may include highly processed foods. That's why we always talk about cutting down on processed foods, highly processed foods. So a lot of parents have reported great improvement after they've removed additives from their foods. Certain food intolerances. Now, so focus on whole, nutrient-dense meals to support gut recovery. Number 3, bloating and abdominal discomfort. Many parents notice their child's abdomen becomes distended or bloated. By abdomen, I mean the tummy. The child's tummy just becomes distended or bloated, especially after meals. This may occur when food is poorly digested and fermented by gut bacteria. So common causes include carbohydrate malabsorption, gut dysbiosis, food sensitivities. Children may show discomfort by pressing their abdomen, refusing foods, increased irritability. So supporting digestion and improving the gut microbiome actually helps to reduce these symptoms. Number 4, food sensitivities. Food sensitivities are very common in autism. These reactions are different from food allergies. So instead of immediate reactions, they may cause delayed symptoms such as behavioral changes, hyperactivity, irritability, digestive discomfort. So 2 major food groups that have been mostly impacted or in this aspect include gluten and dairy. So we've talked about that in our previous videos. Some families notice improvements when these foods are reduced under proper guidance. So the key word here is proper guidance. Don't just remove foods without proper guidance. You can run into a lot of troubles. 5 is gut dysbiosis. Gut dysbiosis means an imbalance between the beneficial and harmful bacteria in the intestines. When harmful bacteria or when the harmful microbiomes dominate, they can produce substances that may trigger the gut-brain axis. So this imbalance may contribute to certain digestive symptoms that we've mentioned earlier, inflammation, behavioral changes. So supporting beneficial gut bacteria is an important part of improving autism gut health. We will talk more on these beneficial bacteria. So, what are simple gut support strategies? Here are a few practical strategies parents can start with. 1. Focus on whole foods instead of highly processed foods. 2. Include fiber-rich vegetables and fruits to support healthy digestion. 3. Encourage balanced meals with healthy fats and proteins. And in some cases, fermented foods may help support beneficial gut bacteria. So always introduce new foods gradually and observe your child's response. That's why we often counsel on getting a journal and journaling what you see. If you want to learn how to support gut health in autistic children using practical nutrition strategies, we have created a guide for parents, and this includes gut-friendly foods, autism diet strategies, and simple steps to support digestion. You can download it using the link below. Also remember to subscribe to our channel for more evidence-based autism nutrition and biomedical insights that are designed to help your child thrive. Bye, and see you in our next video.